recently read a really interesting book by new author and journalist Sam Perez. The book is called Deviate from Denial. And today I'm going to sit down with Sam and just discuss some of her inspiration behind, the story and why she wrote the book. I also had the chance to bring in expert Dr. Rebekah Rollston. Dr. Rollston is a board-certified family physician, and she serves as a clinical research head at Bicycle Health. So I hope you'll join me as we have the opportunity to sit down with these two amazing women who are doing so much to help support those struggling from opioid use disorder. Sam, it must take an incredible amount of trust for people to open up to you about their substance use disorder. How did you cultivate that trust and the relationship for the people you were speaking to in your book?
Yeah. It's definitely a really hard topic for people to talk about, but what I've kind of realized is that people that are in recovery, that are working a program and that really are trying to redirect their lives, they want to share about their experience. Not only does it help them, I think, to share about what they've been through and want to communicate that to people, but also, they've experienced the worst of the worst. And I think that their thought process is if they can maybe help anyone by sharing their story, then that's something that they're game for. And so getting to talk to people was just so inspiring for me to see how vulnerable they were, how transparent and how honest they were. I'm so grateful for everyone who just trusted me with that, not only to tell me, but then to trust me to, display and represent them accurately. It's an incredible amount of trust, and I'm so grateful for it.
And Dr. Rollston, this question's for you. Since you began your medical career, you've been on a mission to help those struggling with opioid addiction. What led you to focus on this area of medicine, and what keeps you motivated to keep going?
Thanks, Tony. It's a great question. I'm from a similar area of Appalachia as Sam, and so I got my start in this work in East Tennessee. And what really sort of opened my eyes and got me going was during my rural primary care rotation in a very rural part of East Tennessee in rural Appalachia. We had to do a community-based participatory research project. So as part of this project, we asked the community members, what are they most concerned about in terms of health? And we expected to hear a lot of different things, but what almost everyone said was, we're worried about the opioid crisis in our community. And at the time, we lived in one of the top 10 counties for opioid overdose in the US, and it's still quite high. And so as part of our project, that's really what we addressed. Was we started creating with community members these small that became incrementally larger interventions for how we could address the opioid crisis in that community, in our rural community of East Tennessee. And so I carried that work through my third year and my fourth year of medical school. I did a master's of public health and have really continued that work from a public health and policy level, as well as clinical medicine level throughout. And I think really what keeps me going is sort of like what Sam said, that as people are in recovery, they really want to share their stories, that they're excited for this this new journey in life. And it's so cool to see people's lives changed like that, and really neat to be able to be part of that process.
Absolutely. And as you said, to move forward in recovery, we need certain tools, and we need to support people that are doing this. And Sam, in your experience, do you see Deviate as a model for the future, perhaps like expanding elsewhere in the country? And have you or other members of your community thought about different types of businesses that can help those in recovery to sort of find their footing?
Oh, absolutely. So Deviate is an awesome restaurant, but really what makes it so awesome is its mission, and that's just giving a second chance to people who need it. And that's something that I think could be implemented in really any business. So the reason my parents were so passionate about, wanting to start Deviate is because they grew up in the restaurant industry, and they knew how much addiction and substance use was bred within the restaurant industry. But with the problem we have right now, it's really a problem in every industry. So I think everyone has the potential to implement some sort of second chance model in their business. So my parents actually kind of pre-COVID did Soulful Enterprise, where they would take business owners and they would basically give them an in-depth look at Deviate and the employment model, because we say that we want, people to have jobs and to become productive members of society. And people that are recovering from addiction or from opioid use disorder, I mean, they have so much potential, so much capability. And I think that's so well served, and they're able to find that when they have just a chance to be able to get employment. And that could be in a variety of different fields.
Yeah, and in support of that, and in supporting them in their recovery, Dr. Rollston, I'd love to hear your comments on the importance of science and evidence-based treatment that actually gets them to this place where they can sort of be in an employment, an opportunity of employment like that.
Yeah. So I think that's one of the really exciting things about opioid use disorder and also other addictions as well. But especially for opioid use disorder, we have such great treatments for this chronic condition. And so we have similar treatments for things like alcohol use disorder with Vivitrol. And we're really growing that evidence base for other forms of addiction as well. But as we see, especially with something like opioid use disorder, once we're able to start people on a medication, so for opioid use disorder, we use something called buprenorphine or methadone or naltrexone. For alcohol use disorder, we can use naltrexone. For other disorders, we can use other medications as well, combined with behavioral health treatment. So it's really neat. So what we sort of think about in the addiction world is how a lot of people like to sort of think of addiction as this sort of more stigmatizing anomaly almost. But the way that we think about it in our space, and I think the way that Sam's family and world sort of thinks about this is addiction as a chronic disease. And so just like diabetes, just like high blood pressure, high cholesterol, depression, anxiety, any of these things that we go to our primary care doctor for or other specialists for, we can also be treated just for that same sort of chronic disease like we can for addiction. And so we have really great treatments for it. For buprenorphine specifically, it's really exciting because there aren't a lot of chronic conditions that can be treated quite as well as the medication like buprenorphine works for opioid use disorder. And so when patients are started on this medication, combined with lots of wraparound supports in their communities, behavioral health supports that could include things like groups, therapists, we really start to see people get that second chance at life, get their lives back on that journey and track that they'd always sort of intended or hoped for, or maybe never knew, but are excited to start on that new path. So, the evidence and science for addiction has really grown substantially in recent years. And I think that really shows that this is something that we're really focused on as a society and committed to, which is great. I think there's still a lot of work to be done, specifically in terms of how we think about stigma or how we can sort of help people get back on their feet within their communities once they're in recovery, or maybe even beforehand. But there is so much science, so much evidence-based treatment that we're already able to offer to patients.
Right.
And actually really, really strong evidence in that regard.
Wonderful. And we'll come back to that question because I want to ask you a little bit about the future of medicine. But Sam, something that occurred to me when you and I were having our conversation and when I read your book, it really does talk about that, opioid addiction doesn't discriminate. And I think this is one of the key things that people need to know. It can affect anyone. And so why do you think that is? Like, why do you think we still have that in our mind that it's something that happens to certain people, but not others?
Yeah, I think that honestly, it's because of the perception of addiction, which Dr. Rollston kind of talked on. I think people tend to view it as this sort of character flaw of like, oh, they just don't have enough willpower or something along those lines, or, they just made a mistake and they can't, kick this old habit. But that's simply not how it is. It is a chronic disease and it needs treatment just like anything else. I mean, like you said, like diabetes, like cancer, whatever it may be. But because of that stigma that exists, it seems like we are so afraid to talk about it. And we are so quick to sweep it under the rug in a way that you wouldn't do with other diseases. For example, cancer. If someone has cancer, it's not this secret that everyone tiptoes around. But with opioid use disorder and with substance use disorder, that's simply, it would be ideal if we could just treat it as, a disease that someone needs treatment for. But I think we're not quite at that point yet. And the only way we're going to get there is if we start to talk about it in a way that is open and honest. And if we start to really try and understand not only what opioid use disorder is, but also, try and challenge our thought processes and our perspectives and how we perceive it.
So Sam, one of the things that I was curious about when I was reading your book was, how did people come to find Deviate, and how did they come to work there? Was it sort of like referrals, word of mouth, or how did that happen?
Yeah, that's a great question. So actually, when Deviate started out in 2017, my parents were just wanting to hire anyone and everyone that needed help. So they would walk outside, see someone walking down the street, and offer them a job if they were trying to get sober. But what they kind of learned through a lot of trial and error is they developed this employment model. So they didn't really know what they were doing when they started out. They just had this idea of wanting to help people in recovery. And so they tried to make it happen, and they made a lot of mistakes along the way. But what they found to be the best way to get employees is to actually form partnerships with different sober living facilities in Lexington. So they work with these sober living facilities or these inpatient treatment facilities to find candidates, and they look for people that are ready for a job. Because just because someone, is sober and they're working in their recovery, it doesn't mean they're always ready to take on the responsibility of a job. So my parents are able to find candidates that are at a good place in their recovery, that are really ready to take on a role. And they find those candidates through their partnerships. And then that way, they're also able to have this open and honest dialogue between the employee, the employment, so Deviate, and then the facility that they're living at and going through treatment. So kind of by forming a partnership between all three entities, that's how they're able to kind of create a sort of checks and balances where they can make sure that the employee is sticking to their recovery and that they're on a good path.
That sounds like a great model, and hopefully, it'll be adopted throughout different communities and moving forward. And Dr. Rollston, I wanted to ask you, when you work with people that have this kind of support, that have this employment opportunity and the community around them, what do you notice in terms of their recovery versus maybe people that are just literally on a path that maybe they're getting help from the medication or whatever? How does what Sam's parents are doing support that recovery process?
Yeah, that's a great question. And the first thing that really comes to mind is the community aspect. So, in recovery, we talk about community and how that is such a key integral part of being in recovery and staying in recovery. And so by having that sort of employment model where they're able to have a job and then also be working with other people in that community. So that means working with Sam or Sam's parents, but also with other people who are in recovery, having those shared experiences, being able to actually really relate to each other, I think is such a powerful, powerful thing about helping. It's one of those in the sort of medical world or public health, primary care, I would call this like a wraparound support. Employment isn't necessarily like a wraparound support, but having a job, having that community built in from your job, I think is such a key part of this. What we see and what we actually saw during the pandemic is the rate of opioid use, opioid overdose, especially in overdose deaths, substantially increase. We know that was due to a lot of reasons. But one of the key parts of that is the isolation, the quarantine, the physical distancing that we really were the main public health measures to take during the initial part of the pandemic, really put people in recovery into this really extreme sort of isolation that is just the antithesis of what we're looking for during that recovery period.
Yeah, I think, when you talk about isolation, it does seem to be a factor in making things absolutely worse and not better. And having that community support can be so key in turning things around along with the other aspects. So this question is for you guys to kind of be creative about, but if there's one thing that you want to, one thing that you haven't maybe been asked in other interviews, or something that you haven't had the chance to speak about, I'd love to give you that opportunity now and just really have a voice to talk about this, from a personal level, or something that you'd like to see happen in the future. Like, what's your ideal scenario when it comes to helping people recover?
Yeah, I would say that I'd just like to touch on the idea that everyone, I think, has a way to help. So, we've talked about the deviate employment model and how business people are able to help provide a second chance to people who are in recovery. But me, for example, I'm a journalist. I love telling stories. And so I don't have a business where I can give people a job. But what I can do is I can take my passion for storytelling and use that to amplify voices of people in recovery. And that's just one example. I think everyone has a particular niche or a particular passion that they can use to help the problem. So that would be, I guess, a sense of encouragement that I would like to give to, whoever might be watching or listening or reading, is just we all can play a small part in working towards a solution. And I think we can all be creative in what that looks like. But, I think everyone has a part to play.
Yeah, I love that, Sam, and I love that idea that everyone can play a part, and I think that's so key. Hopefully, one of those parts that we can all play is also working on our own sort of biases as we think about recovery, as we think about addiction, and that just getting to know people through these stories, through meeting with people in recovery, I think is so powerful. Another thing I wanted to touch on that really comes to mind when thinking about this employment model and talking about recovery is what we often sort of refer to as the war on drugs, how we think about incarceration in this country and how that intersects so much with addiction. And so the war on drugs, I think probably most people are familiar with this concept, but really incarcerating people for drug use rather than helping to rehabilitate them. And so throughout the past few decades, the United States has incarcerated so many people, millions of people for drug use. And that has disproportionately affected Black individuals and other people of color. And I think as we think about recovery and employment models, sometimes we think it can be hard to employ people, say, after they have been released from jail or from prison, or even if they're just in recovery and have never been incarcerated. But I would just encourage all of us to sort of keep in mind the fact that there's always a person behind every story, and that the models that we've seen in the US today in terms of how we have treated drug addiction just haven't really been up to par. And so I think we're finally catching up. We're finally starting to catch up and getting there, but there's still a lot of work to be done, and still a lot of patchwork to really reconcile and attempt to fix some of the harms that we've done to people in the past for using drugs in this country.
For sure. And I liked how you touched on, the stigma aspect. I think we could do a whole other interview just on that alone. And the stories and the faces behind this are really what matters. And so, Sam, I just want to take this time to thank you for writing this book and bringing those to life and, making it real and human for us. For those of you who haven't read it, I'm going to just show your book, Deviate from Denial. You can order it on Amazon. Where else can you get it, Sam? Anywhere else?
Yeah, you can get it at Barnes and Nobles also.
Wonderful. And Dr. Rollston, thank you so much for joining us today and weighing in with your expertise in this area too. I know it's a passion of yours, and I love the connection you guys both have to the space. So thanks again.